Hi, I'm Brittney Heard. I'm a general cardiology fellow at University of Virginia, and we're at ACC 2019. I'm here with one of my attendings, Dr. Christopher Kramer from University of Virginia. He is an imaging guru, I would say. Thank you, Dr. Kramer, for interviewing with us.
Thanks, Brittany, for having me on your show.
Yeah. So what are you looking forward to the most here at ACC 2019?
Honestly, the thing I always look forward to the most at ACC is meeting up with old friends and colleagues and former trainees that I haven't seen in a while, often since the prior ACC. So just networking and getting together with old friends and colleagues.
Exactly. So are you going to be talking this year?
I actually have 4 talks, believe it or not. So I spoke earlier today about the use of cardiac MR to predict risk in hypertrophic cardiomyopathy. It was in an imaging session, which is a really well put together imaging session, involved using MR in mitral regurgitation, in pre-TAVR planning, in congenital heart disease. So it was basically really pushing the envelope of imaging into new areas going forward. I think that's really important for fellows to get exposed to. And I have 2 talks tomorrow. One is in a heart failure session that Dr. Fuster put together, and it's about using imaging, in this case MR and nuclear, both PET and SPECT, to help diagnose and use for prognosis in 7 or 8 non-ischemic cardiomyopathies. So everything from non-ischemic dilated cardiomyopathy to sarcoidosis, amyloidosis, Takasubos, iron overload, non-compaction, hypertrophic cardiomyopathy. So how to use advanced imaging to make the diagnosis and to help assess a patient's prognosis. Again, really important and emerging topic for fellows.
Do you feel like that's currently underused right now?
I think, when I trained, many of these techniques were not available yet. And now we're learning so much about the power of advanced non-invasive imaging. We think that they remain underutilized, but especially because FITs recognize the value, that the next generation of cardiologists will utilize these techniques appropriately. I think the average cardiologist my age may not appreciate the value because they weren't exposed to it during their training. So I think you're lucky that as FITs you're seeing these advanced imaging modalities. My other talk tomorrow is a debate with I taking the cardiac MR side, and Jim Min is taking the CT angiography side. Jim Min from Cornell, and we're debating what's the best technique to plan revascularization for assessing perfusion and viability. So his take is CTA, and my side is CMR. So I'm looking forward to a robust debate with Dr. Min. And then lastly, I have a talk on Monday that's on multimodality imaging, which I think would be a great talk for FITs to see because it's really about how cardiologists can work with radiologists, what fellows should look for in terms of training in multimodality imaging, how many modalities should they become expert in, how to juggle all of that, board examinations, appropriate use criteria, sort of an overview of multimodality imaging and how it fits into fellows training.
Can you give us a preview of that, or you do not want to spoil it?
Yeah, I don't want to spoil it. The FITs have to come to see it.
Well, thank you so much, Dr. Kramer.
Right, thanks for having me, Brittany.
Anything else? Any parting thoughts or advice to the fellows?
Enjoy New Orleans. It's a great place to come for the meeting. You're lucky you have it here.
Awesome. Thank you so much. Again, this is Dr. Christopher Kramer and Brittney Heard. This is ACC 2019. For more videos like this, check out youtube.com/fitsonthego.